Okay, have you guys heard of Zoom dysmorphia? This is a new thing. We've all been stuck at home, communicating through Zoom calls for work, family for some time now. It's safe to say it's had its effects on us. In fact, a study published in the International Journal of Women's Dermatology found that 86.4% of dermatology providers surveyed in the study noted patients citing video conferencing calls as the reason they were seeking care. This is fascinating stuff. Here to tell us more about it is TikTok famous holistic plastic surgeon Dr. Anthony Youn. Paging Dr. Youn, good to see you. What the heck is Zoom dysmorphia?
Well, thank you so much for having me on. So Zoom dysmorphia is this phenomenon that we're now seeing where people have looked at themselves so much on Zoom that it's affected how they see themselves. And they notice these perceived imperfections, and because of that, they end up undergoing cosmetic procedures to try to correct them.
Okay, so let's get into the top 3 requests that you're hearing. And by the way, lighting goes a long way. Let's throw that out there because people are so critical of themselves. So what are the top 3 requests you're hearing?
So number 1 has always been Botox, and we're noticing it more and more. The most common area that we inject Botox are what we call the 11 sign, and these are the 2 vertical wrinkles that we often get when we're scolding our children and things like that. And so that's something that we're noticing a lot on Zoom, and so Botox injections are a way to basically smooth that out.
And I know people were saying with the mask wearing too, that they're so aware of their eyes. So even when outside of the Zoom calls, they're very cautious of how they look, forehead and eyes. Okay, what's the second one? Is it Kybella?
Yeah, no, Kybella is kind of a bit of a niche procedure where it's an injection to basically melt the fat of the double chin. These numbers of patients undergoing Kybella have definitely gone up, and I think it's because, as you know, in TV, angles really matter.
Yes.
And we may know that if you hold your phone up high and you look up to it, it makes you look like you've got less down here, but if you hold your phone down low, it's the opposite effect. And so a lot of people are noticing that they have more in their double chin area than they thought they did, and now they undergo Kybella as a way to get rid of it.
Okay, so that's the thing. If you're always leaning, this is something to think about. Every single day you're crouching, you're leaning. Think about your neck, your posture, your jaw, and what it's doing to your face. Can it, like, expedite any Kybella problems if you're always like this?
Yeah, there is this belief that it's called smartphone facelifts. And so people find that by doing this, they think that they get like what they also call tech neck.
Yeah.
And I don't know that it's a real thing technically. I think it's probably more something that's kind of been a buzzword in plastic surgery. But yeah, definitely there is this thought that the more you do this, the more you can actually develop excess skin in that area.
Can it be avoided? Is it a DNA thing? Is it an aging thing?
It is a general aging thing. Once we get into our mid-50s, we always develop some loose skin under our neck. There are great treatments that are non-surgical for that, starting off with the right types of creams, like a good retinol cream. And then there are non-invasive procedures like lasers and radiofrequency treatments that can help to tighten that skin too.
Third on the list of requests, an actual facelift.
Yes, these numbers have really gone up, and I attribute it to 2 main things. The first thing is we're wearing masks so much now in society that patients can undergo facelifts and within a week go out in public with a mask on and nobody has any idea. So it allows them to heal without people knowing. And the second thing is vaccines. And as the older population, at least here in the United States, they're getting more and more vaccinated. They're feeling more comfortable going out, and now they're having these procedures done where maybe they wouldn't have felt so comfortable even just 3 months ago.
Now, I love this warning, Dr. Youn. You say to anybody who's under 18 years of age, slow your roll when it comes to anything, because you might change your mind. You have to think long game, right?
Yeah, definitely. You have to consider that plastic surgery is a permanent reminder of what could be a temporary feeling. So you may feel right now during the pandemic that, geez, I got to do this, I got to do that. I want to get something done to make myself feel better because, man, it's been really depressing for the last year. But you got to remember that surgery is permanent, and you may feel differently a year or 10 years from now. So if you want to get something done, start with the minor things, get on good skincare, a good skincare routine. If you want to try a little Botox, that's fine, but really be careful with surgery.
Doc, where are you based out of?
I'm in Metro Detroit, so I'm
Detroit.
just across the river from Windsor.
Okay, very cool. It's funny, it's the question I always get asked. Is your hair real? Yes. And how much Botox have I had? I'm about to turn 47, my friend, and on TV, I'm going to say this. I've never had a needle to my face because it's not that you have to. Instagram has made it so hard. Social media, right? Like on camera every day. Do I have lines? Sure, I've embraced mine. It doesn't mean people who want to do it. But at the same time, make sure you're doing it for the right reasons for you, because you can also age gracefully, rock your big Italian nose, whatever it is. You can also just do you. You don't have to subscribe to what the magazines or the Instagram accounts, you know, we know who, the famous people of the world, are setting these unrealistic body ideals where you have to spend tens of thousands of dollars. And like you said, surgery is permanent and there can be complications sometimes. So make sure you do your research and you're old enough to make those decisions,
and
right?
Everything is filtered that you see on social media. So keep that in mind too.
Everything is filtered, although you look 18 yourself. So whatever you're doing is working. Thank you so much. Where do we find more information?
Well, you can go to my website, dryoun.com, and I'm all over social media.
Awesome. Thank you so much, Doc.